The information presented in this presentation is not a substitute for examination, diagnosis, and medical care provided by a licensed and qualified health professional. The opinions expressed by this speaker do not represent those of Advent Health. Please consult your physician before undertaking any form of medical treatment and/or adopting any exercise program or dietary guidelines. If you think you may have a medical emergency, call your physician or 911 immediately. Thank you for joining us for this Advent Health virtual seminar. We hope you'll find the material presented helpful and informative.
Hello, and thank you for joining us today at Advent Health Ocala to talk about living with heart failure. My name is Julie Paradiso, and I am the heart failure coordinator here at Advent Health. We don't always have a diagnosis of heart failure, but we usually know someone who has, or we might have a diagnosis of this in the future. So we're going to start with our presentation, and we're going to start with a video from the American Heart Association of an overview of what heart failure is. Okay, so that was a great video by American Heart Association. That is also a great resource for you to learn more about heart failure. At heart.org, they have a lot of patient resources as well as caregiver resources, and I will list that again at the end of the presentation, but it is a great way for you to learn more about it. So I just want to start off by talking about what does the heart do. So the heart is a strong muscular pump. The heart is separated into two upper chambers called the atria and two lower chambers called the ventricles. The heart's purpose is to pump blood continuously throughout the body. We receive deoxygenated blood into the heart that gets pushed to the lungs, and then it's reoxygenated, and then that oxygenated blood is pushed through to the rest of our organs. When the muscular pump gets weak or doesn't work as well as we need it to, the result is heart failure. And as you can see by this depiction on the right, is the blood flow throughout the heart. Some facts about heart failure, which went over in the video, but just to recap, 1 in 5 people will develop heart failure in their lifetime. So if you don't have heart failure, someone you know may, or someone you care for may have that. 6 million people in the United States has a form of heart failure at one time or another. Heart failure causes 2 hospitalizations every minute. Heart failure costs the nation an estimated $30.7 billion per year, and it is going to increase throughout the upcoming years. An estimated 8 million people will be living with heart failure by 2030. And that number may also increase with new research related to COVID at this time. Heart failure may be more of a long-term condition if you've had COVID and had extreme symptoms needing to be hospitalized. It is a serious condition and there is no cure. It is an end, a diagnosis that will be with you for the rest of your life, but it can be totally taken care of and managed with great lifestyle changes, medication, and we'll talk about that later in the presentation. So what is heart failure? Heart failure, when you say that, people seem to think that the heart it's failed, it's not working. That's not true. It just means it's not pumping as well as we need it to. It doesn't mean the heart's no longer functioning, it just means it's weaker. Symptoms of heart failure can occur if the heart cannot keep up with the workload needed by the body. So if you're not getting the good blood flow out of the heart, that would be a symptom. The body will try and compensate initially by enlarging, developing more muscle mass, and pumping faster. And these mechanisms help for a short period of time. So at first, no symptoms may be noted, but eventually the body cannot compensate any further and you'll have more symptoms. There are two types of heart failure. Recently, we've changed the names of them to HFpEF and HFrEF. However, before they were called diastolic and systolic. As you can see here on the left, the HFpEF, or heart failure with preserved ejection fraction, is the walls of the chambers of the heart, the part that pumps the blood, gets stiff and we don't get enough blood into the heart. When the heart muscle is stretched, we call that reduced ejection fraction, which means not enough blood goes out because when the heart goes to pump, not enough is pushed out because it's such a stretched or large area. This is a great resource, again, from Rise Above Heart Failure, and it really goes over what heart failure is and what we look for. So ejection fraction is a big part of heart failure, and it's kind of how we measure how well the heart is functioning and the weakness. So the ejection fraction is the amount of blood of the heart compared to how much is pumped out. And this is going to be done by your physician. It'll be concluded with an echocardiogram, which is an ultrasound of the heart. It can also be found by using a stress test or a cardiac catheterization. And as you can see here, how much blood is pumped out, we get a number. And if it's in the green, we say that's normal ejection fraction, which is 50 to 70%, which means that the blood that's being pumped out of the heart is enough to keep your body going. If it's 40 to 50%, we say that it's a little bit decreased. So you may notice symptoms at time, and then other times you notice no symptoms. And we can do lifestyle changes and medication to help kind of increase the output of the heart. If it's less than 40%, that's when we are concerned, and you may be more noticeable with symptoms on a daily basis, or even at rest, or you might have more hospitalizations related to that. Many patients are able to improve their ejection fraction and live longer in a healthier life as long as you talk to your healthcare provider, we get you established with a cardiologist, we get you on medications that are going to help you, and do some lifestyle changes for better health. Some causes and risk factors for heart failure include coronary artery disease. So if you've ever had a stent put in your heart due to atherosclerotic disease, that would be one. High blood pressure, whether it's controlled now or was uncontrolled in the past. A previous heart attack, smoking or alcohol use, obesity, abnormal heart valves, and abnormal heart rhythms such as atrial fibrillation or aflutter, severe lung disease such as COPD, emphysema, diabetes, and sleep apnea, either diagnosed or not diagnosed yet. Warning signs of heart failure that everyone should know about, because again, 6 million people have heart failure and they don't necessarily know it until they see symptoms. So something you should watch for with yourself, or if you're a caregiver, would be shortness of breath with or without activity, or increased shortness of breath that you didn't have before. Inability to lay flat or needing more pillows when laying down. When you have more pillows to make sure you don't need to catch your breath, that would be something. Or if you've always slept in the bed and now you've had to move to the recliner to sleep comfortably, that would also be a cause for concern. Persistent coughing or wheezing, swelling in your feet, ankles, legs, or even your abdomen. So if your pants feel very tight at the end of the day and you're going to the bathroom appropriately, if your feet and ankles are swollen and that doesn't go down when you elevate them, that would be a cause for concern. Increased tiredness or fatigue. So if you're feeling more tired throughout the day, needing to take more naps, just don't have the energy or motivation to get going, we definitely need to talk to our physician about that. lack of appetite or nausea, confusion, which may not be noticed by yourself, but you may notice it in a family member, and increased heart rate. This is a tool that we use in the hospital. However, a lot of our physicians' offices also have it. It's called the Heart Zone tool. So what it does is it really kind of goes over what you need to look for on a daily basis. So the green zone at the top is the zone that hopefully you're in on a daily basis and everything is going well. You don't have shortness of breath, you don't have any weight gain, you haven't noticed any increase in your swelling, you have no chest pain, and you are able to do your physical activity that you usually do on a daily basis without having increased shortness of breath. When we have those symptoms and we don't see a change in them, we want to continue to monitor them every day. Take your prescribed medications, make sure you keep your follow-up appointments. We want you to weigh yourself every day, and we also want you to follow a specific low-salt diet and food restriction if instructed by your physician, and we're going to get into that in the next couple slides. However, what I really want to point out is if you start seeing a change in your daily life, increased swelling, shortness of breath, a dry cough, wheezing, increased fatigue, or a weight gain of 3 to 5 pounds, we really need to get a hold of your physician and get you in there to see them so that we can see what's going on. If we ignore these symptoms for 2, 3, 5 days, even weeks at a time, because you're compensating well, eventually you'll get to the red zone. And the red zone is when you have to come here to the hospital because you need IV medication and direct care and hospitalizations. So we want to try to prevent you from getting to that red zone by really noticing the symptoms and getting ahead of them and being in constant contact with your physician if you see the symptoms start. So how do we monitor our symptoms for ourselves or for a loved one that we take care of? Some daily activities I want you to keep in mind would be daily weight. So weight gain of 3 to 5 pounds in a 24-hour period or 5 or more pounds in a week is actually indicative of fluid. It's not that you're eating too much, it's actually fluid. So if you're gaining fluid, the heart is not pumping appropriately. And so we need to get with our physician. It should be done every morning prior to eating or drinking anything and after you use the bathroom. I suggest you get a little Dollar Tree store calendar, keep it next to the counter in the bathroom, and that way in the morning you can write down what your weight is every day and monitor that. And you should have that with you when you go to the physician's office. Your heart rate and blood pressure is very important. A lot of medications for heart failure affect your heart rate, and they also affect your blood pressure. So if your blood pressure is too high or too low, or your heart rate is too high or too low, we would want to make sure you contact your physician before taking any medication. We also want to see the trend of that, and so does your physician. A low sodium diet is very important. If we continue to eat high sodium foods, then we tend to gain water. We hold on to water, and we want to prevent that, especially if we're taking diuretics. Fluid restriction is another daily activity we want you to monitor. Rule of thumb for most heart failure patients is a 2-liter fluid restriction per day, or 64 ounces. Now that will also always be something that you should check with your physician. It will change throughout time if you are a heart failure patient, or if you take care of a patient with heart failure, you would want to always ask your physician at all of your appointments. Medication compliance is a very important part of heart failure or any type of diagnosis of heart conditions. The medication is really what is important to take every day at the same time. Don't run out of your medication. Making sure that if you can't take your medication for whatever reason, you need to contact your doctor. And we always want to make sure that you have a follow-up appointment. We want you to see your doctor on a regular basis so that they can see changes or make changes to medication or your lifestyle to prevent us from getting to that red zone where we have to come to the hospital. So here's a little bit more about low sodium diet. So it helps prevent water retention. Generally, 1,500 to 2,000 milligrams of salt per day is what a heart failure patient should be following. Just for references, 1 level teaspoon of salt has 2,300 milligrams of sodium. So that's a huge amount that we probably wouldn't think that we use that much, but we actually probably do. So we really need to refrain from using salt in cooking, processed food, or adding any salt to food once it's cooked. Reading food labels is the most important thing. When we're in the grocery store, processed foods, boxed foods all have sodium, so they have a longer shelf life. So low sodium foods can still have more sodium than appropriate serving, so you want to make sure you're really reading the label. So even though it says low sodium, doesn't mean it's still a great option for someone who has heart failure. Some foods to avoid would be canned or processed foods, sauces, ketchup, anything that has a thickness to it, especially for sauces, would be high in salt. Pickled goods usually are high in salt, and fast food or even eating out is very difficult. We try to say if you're a heart failure patient, you should eat out on special occasions and try to limit that to almost nothing, because the reason why that food tastes so good is because it's full of salt. And you will notice if you eat more salt on one day, you'll probably have more symptoms of heart failure the next, which could include swelling or shortness of breath. And of course, I always want to make sure you ask your physician what exact diet they want you to follow. Because of certain medications and renal disease, diabetes, you really want to make sure your physician knows what kind of diet you're following at home and make sure that that's appropriate for you. This is just generalized information for any heart failure patient, but again, ask your physician. Here's some options, just I wanted to explain to you why you would think that certain things don't have a high in salt, but they are. So whole milk is high in salt. I did not know that originally, but it really is. Butter, margarine can be high in salt. Again, mayonnaise is a thick kind of topping, usually high in salt. Salad dressings, again, thicker, high in salt. Lunch meat, processed cheeses are very high in salt. Canned vegetables, always buy the no sodium vegetables, or if you cannot find them, another way to get around that would be to rinse the vegetables out of the can prior to cooking. So that's another kind of side thing you can do if you only have the high sodium or regular sodium options available to you. We can still spice our food, just not with the salt. So Mrs. Dash is a great option, fresh garlic, fresh lemon, fresh dried herbs, onion powder, garlic powder, not the salt part. And fluid restriction is another thing I really want to make sure that you talk to your physician about. Not everyone has to be on a fluid restriction all the time. And at some points within your heart failure diagnosis, you may have to be on a very strict fluid restriction. And then at other times you may not need to. So I really want to make sure that everyone understands that you need to ask your physician what you specifically for yourself need to follow, or if a person you're caring for needs to be on a fluid restriction. But just to go over, again, rule of thumb is 2 liters per day. All liquids are included within that in a 24-hour period. And what is interesting is a lot of people say, oh, well, I don't drink that much water, but it's not just water. It's anything that will melt at room temperature. So some examples that people don't think of is ice cream. Ice cream melts at room temperature, so that is considered a fluid. Popsicles, soups, and I want to point out with soups, again, those can be very high in salt unless you make them yourself at home and you know what you're adding into that. Gelatin, Jello is something a lot of people like to eat, but again, that is a fluid. Watermelon, high water contents, you'd want to limit those. Some tips or tricks for fluid intake. Use a container to track the amount of fluid. We're kind of creatures of habit, so we pretty much eat and drink similar things on a daily basis. So the best thing to do is to use the same cup every day and use that cup throughout the day to sip from. Fill it up, see how many ounces that is, and see how many of those you can have. Or usually containers, if we buy processed things, a juice may have an ounce on it, so add those ounces up. Always keep a measurement or conversion chart handy so you know how much you're drinking. Thirst is a big thing. When we start to limit our fluids or things we're eating can make us thirsty. A lot of diabetics say that they're thirsty a lot. So some things to kind of help you combat that and not go drink a bunch would be to suck on ice chips. So not a huge amount, but that was less than a whole glass of water. Small pieces of fruit like strawberries or blueberries, if you freeze them and suck on them, it's a source of nutrition, good vitamin C, and then also quenches your thirst. Drink beverages cold rather than hot. I always recommend if you're going to have that hot cup of coffee, make sure you do it early in the morning. If you drink it later in the day, you'll be more apt to be thirsty towards the evening and at night, and you'll probably want to drink more. And remember, with our 24-hour period fluid restriction, that includes the medications that we need to take that we have to have water for. So make sure you keep that all in track. If you track it for a couple days, I would suggest 2 to 3 weeks, you'll see kind of where you are. So we don't think we're drinking a lot, but most people are drinking more than they should be. And on the right here, just as a reference, so 8 cups is 64 ounces, and that's 2 liters. 1 cup is 8 ounces, so you'd want to make sure you measure the container you're going to use. and use that as a reference of how much you drink per day. The other thing we can do is if you took a 2-liter bottle and you emptied it, and if you drank a cup and you had it half full of juice, when you're done with that, you fill that cup back up to the same line with water, and you would dump that into the 2-liter bottle. If you did that with everything you drank throughout the day, it shouldn't overflow that bottle. So some common heart failure medications that you may be started on are included here. They're used to help your heart function more effectively. Many of the medications are used in conjunction with other medicines to treat other issues. So a lot of us may not just have heart failure, but you might have high blood pressure. You might be a diabetic. You might have a thyroid disorder. So a lot of these medications may or may not be used together with them. They may be used alone, or they may have to be stopped because of other comorbidities that you have. But just in general, most heart failure patients are on a diuretic and a beta blocker. Some heart failure patients are on an ACE inhibitor or an ARB in conjunction with a beta blocker and diuretic, especially if you have a low ejection fraction below 40%. Another type of diuretic that we use is called an aldosterone antagonist, which would be aldactone is the most common known, or spironolactone is the most common name for that. And that is used in conjunction with Lasix or Bumex to help get better output from the kidney to prevent more swelling. Physician appointments. This is something that's going to be part of your life, especially if you have heart failure. But what I really want to point out is questions to ask your physician. You have to make sure that you're your own advocate and ask these questions every appointment with your doctor. You need to have clarification so you know how to care for yourself or a loved one once you leave that office. Make sure they give you the time to answer these questions. So some recommendations I have is, how serious is my heart failure? What is my ejection fraction? What should I be concerned of right now? Am I a candidate for cardiac rehab? Cardiac rehab services is a great service. It has recently been added to treat heart failure patients if your ejection fraction is 35% or lower. Or if you've had a stent in the past or a recent stent, cardiac rehab is always recommended for you. It is a great program. We offer it here at Ocala, at Advent Health Ocala, and it would be a good thing for you, and your doctor can recommend that. Do you have any activity limits? Should you or should you not be doing certain things that may irritate your condition? What are your current treatment goals? What kind of medication am I on? And what am I looking for that? What is my goal blood pressure? What should I report if my blood pressure is too high or too low? Going back to diet, how much sodium should I be eating? Is that something I need to watch very carefully? What is my food restriction? Do I need to be on a food restriction? Am I drinking too much? Am I drinking too little? And then, of course, what is my ejection fraction? That is an important number for you to know, not just for yourself, but when you go to different physicians' offices. It's something that they should be asking, and you should be able to know what it is. It's an important part of your health, such as medications. What to bring to your doctor's office? Your daily weight log. So we're doing it every day. Bring it so you can show the doctor. Blood pressure log. We want to see if your blood pressure is too high, too low, how it's fluctuating, so that we can alter medications as needed. Your fluid intake log, so that if you're drinking too much or drinking too little, or not sure if you're doing it right, wrong, or otherwise, bring the log with you and have them go over it. Your symptoms. So if there's certain days that you always have shortness of breath or with certain activity, write it down, because when you go to your doctor, you're going to forget how you felt 3 weeks ago, especially if you feel better. But your doctor needs to know that information to better treat you. Your medication list, again, with all medications you take, including herbals or supplements. Do not just give medications that come from the pharmacy, because all of them can interact and we need to review them for you. And then list of physicians you see. So just because you're at the cardiologist office doesn't mean that he doesn't need to know that you see an endocrinologist or that you don't have your primary doctor. We need to know who your primary doctor is so we can share that information and make sure you're getting the best care. Some helpful resources for you. I use them myself to teach here at the hospital for patients, and they're just really great for if you have any questions, want to learn more about heart failure. They have great patient tools on their websites that you can print out and use to take to your physician's office. It's a really great way to educate yourself more, either for yourself or for a loved one. So keep it pumping. Rise Above Heart Failure, again, is the American Heart Association website, togetherandheartfailure.com. All of them have great videos, interactive things you can use. GoodRx, I'm sure you've seen lots of commercials about it, is a way for you to help provide medication if you are having trouble affording them. And then Heart of Florida is our local medication physician office that we can get you into to help with medications, appointments for lower income issues. So they have a website as well that is very helpful. So I'd recommend you review all of them just to move forward and get more information about heart failure. I appreciate you listening to our education piece on heart failure. I hope I gave you some information to think about and some resources that you can reach out to after this presentation to learn more about heart failure. Please take care of yourself, your health, and your loved ones. Thank you.